Is there a stigma behind medication-assisted treatment and the work that's being done?
Oh, totally. Absolutely. And, you know, and that's one of those deals where, to educate the industry and people outside of the industry about a little bit more. At the end of the day, we utilize any tool that's appropriate for the client. So that could be medication-assisted treatment, including buprenorphine or Vivitrol, or even abstinence-based treatment programs. So at the end of the day, there's not one size fits all, and we, you know, stuff a certain medication down their throat and hope for the best, and they're going to be cured and all that stuff, or they're just taking another drug, you know, at the end of the day. So our saying here at Miami Valley is the medication, if we're talking about buprenorphine, is to get you stabilized, you know what I mean? Not to be sick all the time and all that good stuff. And then that gives you the tool to be able to work on yourself, because at the end of the day, the most important thing is the therapy and basically building up your self-confidence and basically having a purpose in life. And that's what our goal is, to help people find out what their purpose is. Simon Sinek wrote a great book, and it's really business focused. And it's what's your why? You know, why do you do what you do, and why, you know, and I kind of spin a little bit on, you know, why are you here? What's your purpose? And our goal is, you know, some of the most talented people as a mechanic or a drywaller or a framer or something, that could spin off and, you know, start their own little business, or they just need the tools and some of the direction. And, you know, Miami Valley Recovery isn't just about, hey, you know, let's talk about relapse prevention. It's, you know, it's more than that. It's case management. It's all those type of services. So
all outpatient,
much
right?
bigger.
All outpatient?
All outpatient. So which I tell people, I said, outpatient's the hardest, you know what I mean?
Yeah.
So they're in our four walls during, you know, a number of hours during the day. And when they leave that, you know, leave the facility, you know what I mean? It's kind of what the tools we've brought to them on, you know, how do you take it outside the four walls? And I've always said outpatient treatment is the hardest there is. Now, we've had clients where it's, you know, based off of their living situations or whatnot, you know, we'd have to get them, you know, we work closely with some of the, an inpatient program here locally called Woodhaven, and we get them in there, and, you know, they get some 30, 60, 90 days stable, or it gets at least them cleared, and then we can work on getting, you know, different living situations, things of that nature. So it's a big team. I mean, it's not an easy, you know, you just check in and, you know, let's talk about a couple things and then we'll see you later. So
huge effort. And you know what, on that point, Bill, I really liked on the Miami Valley Recovery website, little plug there, I love that you had the psychiatric emergency area on your website. Do you think that medication-assisted treatment can really provide a nice stepping stool for someone that's having some problems and troubles and hardships and cannot do the 12-step? Is that a good route for them to go the medication-assisted treatment route?
Yeah, in my opinion, and you'll hear different opinions, but in my opinion, absolutely. You know what I mean? You know, in our what we kind of think of it is, you know, when somebody walks through our door, which is I would consider one of the hardest things to do, and saying, listen, I've got a problem, I can't, you know, control this, and you know, we've always said, hey, you know, we're going to work harder than you to get you stable, but at some point we got to kind of meet in the middle, and then you got to work harder than us. So there's a transition phase type of thing there. So, but yeah, you know, to your initial question, MAT, where sometimes the 12-step, you know, might be a little challenging for some folks, and you know, the NAAA community, depending on the types of meetings, they come around to recognizing it where it's not so, I guess, attacked in a certain period of time. There are some meetings that are, you know, it's absolutely, you're just, you know, doing one for the other type of deal. But then we've heard from other clients that somebody recognizes MAT as a good tool. So, you know, you just refer to the Betty Ford Foundation, you know, Daryl Strawberry's group, you know, you know, some of those have started recognizing the MAT perspective of treatment.